Late last year, when the governor and the lieutenant governor's budget rolled out, there was a funding line missing. No appropriations to keep Mount Pleasant and Clarinda Mental Health Institutes open past June of 2015. There would be a 30+6 bed realignment, moving the beds to the Independence MHI. No announcement or meeting with legislators, no transition plan shared. Since that time, there's been a flurry of fact-finding and legislative action to slow these closures. As chair of Human Resources, I joined a group of legislators, Senators Sigebart, Costello, Hogue, and Gronstal, to tour Clarinda's MHI on Friday and to hear from patients, their families, and mental health care professionals. My first impression of MHI in Clarinda, built in 1888, was that it was clean, it was spacious, and accommodating. And people there are professional and they care about what happens to the patients. They're also concerned about their employment future. But it is evident after speaking to healthcare workers in the community, the mental health region, made up of several counties in southeast Iowa, is not ready to handle short-term crisis if the Clarinda MHI is closed. Again, they are not ready for this. We met John, who was there after having a mental health episode. John was in a 15-bed unit for acute patients. His family was from Atlantic, just 35 minutes away, able to visit him regularly and help him get better. Now, if Clarinda closes, people like John will have to travel about 4.5 hours to the Independence MHI in a psychotic state in the back of a car. The distance would definitely prohibit regular family visits. We also saw the geropsychiatric unit with 20 beds. These beds are occupied by people who have serious mental illness. We walked through the ward and saw people who clearly would never be able to function in a community-based setting. And if a private long-term care facility were to take them, the staff would need high-level psychiatric training to handle the sometimes violent, unpredictable, and complicated cases. We learned that Clarinda's MHI has 33 people on a waiting list, and they get calls daily from other counties as far as 5 hours away, looking there for an open bed. They would like to accommodate, but the Department of Human Services told them to stop accepting patients pending this program closure. Now, there are some serious questions yet to be answered. How will the Independence MHI hire, train, and prepare to staff 36 more beds by June? Will Independence be able to prepare their facility in a few months to meet the demands of the patients transferred and the high standards needed to pass rigorous inspection? And what's the plan for placing psychiatric sex offenders in secured facilities before the end of this fiscal year? We heard testimony a few weeks ago in the Human Resources Committee from 2 Cedar Rapids Hospital psychiatric clinic directors regarding the state's bed shortage. One of the clinic directors said that in one weekend alone, he had 25 emergency cases and scrambled to find beds for 10 of those cases. Clearly, the closures in southwest Iowa, in southern Iowa, will affect everyone. Turning off the lights at Clarinda and Mount Pleasant is not a transition plan. Eliminating a line in the budget is not a transition plan. Open discussion, a design, and time is needed to make this work for the vulnerable patient, their families, and our mental health communities. Thank you, Madam President.